Okay, welcome to another episode of Conversations with Neighbors. Today we got Dr. John Ryan on the show. Welcome.
Thank you. Thanks for having me.
Okay, so we're going to dive into a whole bunch of things. But before you got into what you're in now, what was your kind of upbringing like? I know you were in athletics. Talk to me about kind of I always like the origin story.
Yeah. I was just an active kid. I was a soccer player. That was my main thing. I got put into everything when I was little. Even things that weren't sport related. I got put into dance and acting and that kind of stuff too. But soccer was kind of the only thing that stuck. Played competitive soccer until about grade 12-ish, till I was like almost 18. Was pretty good, played at a competitive level, got called up to the provincial team a little bit. But it was just so much of a commitment, and I was so like focused on school at that point too. I always got pretty good grades growing up, so I kind of had to make a decision, and it was my time to quit. So I went into kinesiology and health science at York University, and I kind of wanted to incorporate sport in some kind of line of work or career, whatever I chose. I didn't really know exactly what I wanted to do at that point, but I liked science, I liked biology, and I kind of went on from there, and um, still was being pretty active at that point, more into like weightlifting and running, and still playing soccer. I still play soccer now,
Yeah.
like Sunday league, but not the same thing. But still keep that aspect of my life.
I always, I played sports growing up, and you don't realize it when you're in it, but like there's so many things that like sport and team sports that then apply into the rest of your life.
Yeah.
Teamwork, hard work, dedication, wins, losses.
Yeah.
Do you feel that now, and kind of now that you're in your career, that you've taken kind of the world of sport and applied it into the other areas of your life? How do you think about that going hand in hand with career?
For sure. I think one of the biggest things is, as you said, working kind of in a team environment.
Yeah.
And in healthcare, and probably a lot of other professions, but in healthcare specifically, I think you do have to kind of be able to work with others in terms of creating that circle of care for your patients, because it's not just a one-man job kind of thing. And the more you can collaborate with other people who are involved in that patient's life and their care, the better their care is going to be. And like going back to my soccer days, like if you had a dispute with another teammate, if you didn't agree on something in practice, if you had different ideas about how to play the game or whatever, then you spoke about it and you moved through it because you had a job to get done at the end of the day. And it's kind of the same thing at work now. We all have the same goal.
Yeah.
Me and then whoever else that person is seeing.
Yeah. And so we go into school for kinesiology. Was it like, were you thinking about health? I put health in like a big bucket, or were you just interested in like the body and movement because of that sports background? Like, which way was it? Did it start? And then I guess you start in one direction, then it kind of grows and expands as you dive into the whole world of it, right?
Yeah. I think I was always going to end up doing something in health. I just didn't know what. I had thought at that point, when I was kind of coming to a close in my undergrad, if I wanted to go into research, because I really liked one course, physiology. And I had one professor who was this really cool guy from France, and he was really into Krav Maga and skiing. And he came from a part of France that was like, they had oceans and like ski slopes at the same time. So he was a very active guy. So I kind of like was being led by his example, and he was into research. So he was researching how how cells kind of reacted to certain environments and things like exercise and how that can affect it. So I knew I wanted to do something in health. I didn't know if it was research related. I didn't know if I was going to be a doctor, a nurse, a physiotherapist, whatever. I didn't know, but I knew that it was a field that I enjoyed. I wanted to work with people. I liked people, and it kind of just unfolded as it did. I didn't end up kind of knowing what I wanted to do right off the bat.
Yeah. So what was kind of the progression of it? So obviously you're directional, you like health and the body and people, and you're kind of have a athlete brain and performance and
Right.
all this. And so walk me through the progression of kind of where you land on.
Yeah. So I'm in my fourth year of my undergrad. no clue what to do, coming to a close, knowing I need to, keep a certain level of grades to be able to apply to graduate schools or whatever afterwards. I'm I'm kind of thinking I would like to be a doctor, but med school in Ontario is kind of crazy to get into. A lot of my friends who do that are into health as well, or wanted to get into medicine at the time, were maybe going abroad. Maybe had a family member, like a father or a mother, who was already practicing, who kind of helped bring them into the system a little bit. Had connections in that way. I couldn't see myself going abroad. It was a lot financially to ask too of myself and my parents, whoever was supporting me at the time, and it didn't seem like that was what was going to happen. Um, and then I thought about other things, like I said, physiotherapy
Mhm.
research. I ended up doing an extra year, or an extra one semester, um, doing an independent study with this professor that I really enjoyed working under and learning from. And I worked in a lab like 3 4 days a week, and I was just bored out of my mind. There was no like social
Yeah.
contact with anyone. It was just me and like test tubes and like working under a fume hood, and I was just bored. I couldn't get through it. At that point, I knew research wasn't for me. Um, and so my mom is a nurse. She worked at CAMH for a very long time. CAMH is the Center for Addiction and Mental Health in Toronto. And she worked downtown, and her old nursing school had then been converted. That building had been converted into a naturopathic medical school. And I had never heard of
Mm.
naturopathic medicine at the time, but we were driving by the school, and she's like, "Oh, I went to nursing school here, whatever." And I was like, "Oh yeah, I know. It's near my grandparents' house and near Fairview Mall." And she's like, "It's I don't think it's a nursing college anymore." And I was like, "Oh no, what is it?" And then she's like, "Something about naturopathic medicine." I was like, "Oh, I don't know what that is." And she's like, "You might be interested in it. Whatever, you should check it out." So I looked it up. They had an open house. I think it was like in August or something, which was around the time I started my then fifth year at York. Um, and it seemed interesting. It seemed like, I could still be a doctor. I could still see patients. I could diagnose. I could test. I could treat them in all the ways I wanted to. And it kind of was maybe even more aligned with how I viewed health and the body than a medical doctor thinks. Still kind of the same medical schooling, but different kind of outlook on health and um, improving health. And that's kind of how I got into that.
Yeah, and it's funny how like the life journey does it, where you have to go and test, like in the research lab, and then you're like, okay, clearly there's a piece missing to this, where it's like people, right?
Yeah.
It's like a lot of study and feedback, but it's
Yeah.
like you said, you're in the lab 4 times a day. It's like, where's the social interaction, and even the kind of that uh, a lot more. I don't know if theory is the right word, but not in practice, right?
Right.
With like the true feedback loop that comes back
Yeah.
with it.
Yeah, for
and,
sure.
and then come across naturopath, which we'll kind of get into. I feel like that's it's trending now. Like more people are more aware of it, where before it was kind of like this underground thing. It's like, because everyone's so used to like what we would call, I guess, Western medicine, I guess,
Yeah,
right? Like,
conventional medicine. Yeah.
which I guess you could tell me is more like reactionary when something's already wrong, not prevention. And
Hmm.
and then as well too, you having a general interest of like how the actual body functions with like cells, and the body is this amazing thing that kind of self-regulates itself, and it can just be off for a variety of reasons, right?
Right.
So for someone that doesn't understand like naturopath, like try to explain it in like the easiest terms possible, I guess, like if you were explaining it to friends and family, what do you say?
Right. So I'm a naturopathic doctor. I practice naturopathic medicine. And what naturopathic medicine is, it's actually an umbrella term. So under that umbrella is a couple of different, or actually more than a couple, is many different branches of medicine. So it includes things like nutrition and lifestyle medicine and exercise and moving your body, and also botanical medicine, so medicine that comes from plants. I would also argue that most medicine, all medicine, even medications, come from plants. Things that we know that help your body in some sort of medical way. The drugs come from an isolated part of a plant that we worked 1,000 years ago or something like that. But so botanical medicine is another part of the under that umbrella of naturopathic medicine. Um, a lot of talk about supplements these days, and supplements that come from vitamins, minerals, plants, whatever. All that falls under what I do. And then there's things like traditional Chinese medicine and how things like acupuncture can help as well. So there's all of these different modalities that fall under naturopathic medicine. And I kind of get to have all these tools at my disposal to help certain patients based on their needs, their concerns, and what we're trying to achieve in terms of their health goals. So I'm very general in a sense. People come to me with various concerns, the same way they would go to their family doctor with different concerns, whatever's bothering them at the time. And then we kind of figure out a plan and move from there. And, sometimes there's some conditions I can help with a lot. And then there's some things I need to refer. I need to say, I need to work with your family doctor because maybe you do need to be medicated for this, but then we need to work on maybe some lifestyle stuff alongside that. So,
It's just so
it's a lot.
funny. It's just, it's like, this is why I love that this is trending up,
Yeah.
where it's like, at the core of it, okay, what you consume into your body, diet, right? Like,
Yeah.
and as well, movement of the body. And like, it's like your body is this machine, and,
Right.
we're feeding it with all these things that aren't really helping the operating system, both from a software and a hardware standpoint too, right? And it's just like, if you really just think of the big picture of it and just bring it down to the basics, right? First, as kind of like the foundational level.
Yeah.
And then obviously there's going to be outlier cases where, there's a special medication,
Right.
and that's great that exists. But,
Yeah.
for the majority, it's like, bring it down to the basics of like, what are you deficient in? What are you not doing? And, supplementation or just general intake,
Right.
is going to help a ton, right?
Of course. Yeah. There's kind of, I like to say the foundations of your health. Those are eating well and what you're putting into your body, making sure you're sleeping well, making sure during the day you're moving your body. And then there's like a social aspect, making sure you're spending time with people and friends and family and getting that into, because that is a big part of how mental health works. But if we can get those basics right, there's a good chance that you're going to be in a pretty good place for most of your life.
Yeah.
And then it's about like outlier conditions or diseases that pop up or things in your family history you can't avoid or accidents. And those happen too. And then we deal with those at the time. But if you can get the basics right, you're going to set yourself up for success in the future. So,
yeah. And that's kind of why they've been doing that for 1,000 years, right? It's
Right.
like those
Yeah.
like sleep, intake, like consumption,
yeah.
movement,
Yeah.
social interaction.
Yeah.
No matter how much the world has changed,
Yeah.
we can just boil it down to those
Yeah.
kind of four core.
Yeah. It's actually interesting. I had a case the other day. I had a patient, a 7-year-old woman. And when I look at her, I don't feel like she looked, I didn't know she was 70. She's in pretty good shape. She is very lively. She has the energy of like, someone who's 35. But at the time she was dealing with a lot. Her mother was kind of on her last days, ended up passing away. Sadly, her sister just got diagnosed with some mental health disease, and she had a lot on her plate. She was really stressed, and because of that period of time, for like 6 months, she wasn't eating properly. She wasn't sleeping properly. She stopped exercising and doing the things she really enjoyed in the past, and then she went to her family doctor for like an annual appointment to see how things were. Her blood pressure was going up. Her blood sugar was not being regulated properly. And the doctor didn't really seem to be interested in maybe the reason why all this was going on, and kind of said, here's a medication, I'm going to up your meds and see what happens, whatever.
Yeah.
Let's see if we can do something about it. And to me, that was a bit, I'm not sure what the word is. Like,
That's not the play.
It's not what I would have done.
Yeah.
And it didn't seem like I mean, the Ontario healthcare system is not in a place that sets up a lot of our doctors for success in the first place.
Yeah.
But with that being said, I think with the time that we do get, maybe we can try and do a little bit better. And if we can't, maybe, look at other options for people who can spend that time with their patients. Cause, I think if that person's lifestyle was just changed in the next 6 months, I don't think there would have been a need to adjust their medications.
Yeah, that's why it's so important to have these other modalities that are out there that exist, which, you could boil that all down to stress on her system, right? And then if you just are like, listen to all those things that you kind of listed of, that mental stress, which then brings onto your body and your nervous system. And then you naturally don't do the things that you need to do to kind of get out of there too, or build like stress resilience or to help your nervous system out too. So then it just compounds on itself.
Yeah.
And then it's just like, okay, here's the fix of it. But really it's a more holistic, bigger picture of the whole thing. Right. Yeah. I've been like super obsessed with stress this year because towards the end of last year, I think it was last year, I guess I didn't realize how stressed I was, and it was showing up like it was the first time ever feeling like anxiety, right? Mm-hmm. And it was like anxiousness would come over me, and it'd be like, all I want to do is run away from this room. Like I need to escape this thing, right? And this led me down this rabbit hole of like, what is happening? And it landed in on stress and my nervous system and, just being jacked up the whole time, in fight or flight mode, like 100% of the time. Yeah. So then obviously, my brain is triggering like something is wrong because the body is saying, something is up here. Yeah. Right. Yeah. And then that just led me into like a heavy breath work, routine and decompressing and like a lot of yoga nidra and stuff like this. And so whenever I hear something like that, it's like if you just went to the doctor, you'd just be like, here's some type of medication or something, right? Yeah. But now I have a much more resilient stress tolerance and as well awareness of it too, right? And that's important. And then you kind of bring in all these different practices to kind of help with the situation and improve it overall.
Right.
And so you're at Align, right? And Align feels like very aligned with kind of your life philosophy and, how you see the world and to handle patients. How did you get connected with Align? What was that process like? And how has it been so far being with them?
It's been great. Align's kind of like, I've only been there maybe a year and a couple months now. I think I started in October and now it's December. And they already feel like kind of a family to me. I get along with everyone very well. And there's actually one physiotherapist, Jonathan, our families know each other. So it was kind of like slotting right into the groove as soon as I started working there. And it like you said, they do align with how I like to practice. So this was my first job after graduating and getting licensed from school. I was kind of looking around and seeing what might work. I really wanted a mentor, someone who was in my shoes and who does what I do and was experienced, someone I could learn from, ask questions, because I was really nervous about being on my own in the beginning. Mm-hmm. In our last year of naturopathic medical school, we had placements in different urgent care places and clinics, community health clinics, different kind of things like that. And we were always supervised by another doctor, and we had peers to work with and ask questions about too and stuff like that. So I wanted that same kind of that teamwork aspect again. I wanted someone to bounce ideas off of and talk to every single day. And so I was looking at different places, and Align came up on. So I was looking at like job ads and talking to friends, and even going on Jobs Indeed and things like that. But Align popped up on Google when I just Googled naturopath and healthcare clinics, and Dr. May's name popped up. Dr. May is a naturopath who works there, and she's been there for like, I don't know, 10, 15, maybe almost 20 years, something like that. And she's so knowledgeable. And so I just reached out to the clinic and I said, hey, like, I see you've got one naturopath already. Would you be interested in having another one work for you, kind of thing? And I mentioned Dr. May's name. I was like, I would really like to be mentored and to work with Dr. May as well to maybe build something there. And they kind of were not expecting another naturopath to want to join the team, but Dr. Sanderson was pretty excited, and we had some good conversations from there, and I ended up joining.
I love that. And yeah, it's a great team, great organization, great business there. And as well, too, you're going to have someone to bounce ideas off of, work with, kind of build that experience.
Yeah.
And then again, they have available all those different practices, right, that you can lean on too, from chiropractic to physio, to massage, all these different elements too. So again, going back to kind of this full picture of health, this holistic view of it, is always important. And I know that kind of working with aging adults is important to you, right? And another trend that I love to see too, it's like not about age span, it's about health span, right? And being healthy and active into your later years of life. So talk to me about that importance in your practice and how you think about the aging adults, because, we've never had this cohort of people all reaching into these later years in their life too, with the baby boomers. So
So one thing, when I was an intern at school in my placement, I was noticing that, especially in community health centers, healthcare clinics, where maybe there was a lot of older, less financially stable individuals coming to seek care. I noticed that a lot of seniors were kind of falling through the cracks. Maybe they were immigrants who didn't have a family doctor. Maybe they had been in Canada so long that their family doctor passed away and they hadn't got a new one, because no new doctors are accepting patients at the moment. So they didn't have a main person to care for them and to look at them and speak to them about health. And I just thought that was a population that is being critically underserved. And there's so much we can do for seniors, like you said, to help improve their quality of life, not just how long they live for. But, that at the same time, too, I want to preserve their life as much as possible because they want to as well. But I really enjoyed working with seniors. I don't know why. I just, anyone who was 60, 70, 80, they came to my room and I ended up feeling happy after the appointment. And it seemed like they were kind of on the same page. I had, around Christmas time, I had seniors like coming out to me as a student, like bringing me gifts and like cards with like money in it and stuff. And I was like, I can't accept that. And I'm your doctor now. And they're like, oh, well, I want to just, show my appreciation for what you're doing, because no one had really been doing that for them in the last 5, 10, 15 years. So when I got out of school, I tried to make it one of my goals to treat seniors as well as I could. So I have a passion for them and for treating them and trying to make them, to get them to the place they want to be at and how they feel as they get older. And so I do talks at old age homes and retirement homes, and I speak on things like health and simple changes they can make in their day-to-day, and I educate them on supplements and stuff like that, and nutrition and moving their bodies. So it's a big part of what I've been doing so far. And like I said, my practice is general, but there are certain populations who I definitely feel a bit of a passion to work with more. Yeah.
And that's like a classic demo too, where obviously they're aging, bodies are changing, right? Where kind of traditional will be like, oh, it's getting old, so the fix is X, Y, Z instead of, this other bucket over here too, which, aren't going to have these, I guess, other effects, because, everything is going to have an effect. You might be putting a Band-Aid on something else, but it might show up somewhere else where kind of the more natural side of it will make them feel better and, more active and will be overall better, right?
Yeah. One of the things I really like to do as a naturopath is try to find the root cause of people's problems, and it's often there's one cause for like three of their concerns, and often, like you say, it's just kind of band-aid solutions that get
Yeah.
presented to them and paper over the cracks kind of thing. So I like to really try and find the cause and do something about that. At the same time, I do want to make the person feel better while that's being treated. So will address the symptoms of what's going on
Yeah.
too. But I think if you don't get to the cause, then the issue is not really going to go away.
Yeah, like you're going to go on the journey with them.
Yeah.
Right. And
Mhm.
and find the root cause of it too, which
Yeah.
takes time, right? It's not just, oh yeah, it's this exactly, that you're all good, right? You have to kind of progress along with them to find those true root causes.
Right.
And it's going to take some time. So you have to go on the journey with them.
Yeah. Yeah.
What are some like patterns that you see of patients that come to you? I'm sure, you work with a lot of people, different ages, different demos,
Yeah.
but I'm sure that there is some type of pattern recognition that you see and things that are more common than not.
Yes, definitely. And this brings me to a big subject actually that affects many different conditions and patients. Um, Blood sugar regulation and insulin resistance is massive. It's a massive part of metabolic health, and it affects so much more than just your blood sugar alone. I've had patients with gout improve because their blood sugars improved. I've had patients with mental health improve. I've had patients with PCOS, polycystic ovarian syndrome. I've had patients who want to lose weight improve because their blood sugar wasn't being regulated properly, and now it is. So I think it's one of those things that is connected to so many other concerns. And if I had to guess, I would say the majority of the population doesn't have their blood sugar in check and is some sort of insulin resistant to some extent. And that probably includes myself. So I kind of like to practice what I preach. And I work on my health at the same time as I try and help patients work on their health. So anything that I give to a patient, I want to know what it's like. And so I don't know if you can see, but there's a little circle here. It's a CGM. It's a continuous glucose monitor. So I'm trying out these things too, just so I can tell my patients this is what's going to happen. This is exactly what you need to do. But blood sugar is one of those things where I think it's affects everybody.
So you have the continuous measurement, and then is it just seeing what you're eating and seeing what the effects are in the blood sugar? Is that kind of the core of the practice of it?
Yeah. So when you eat carbohydrates eventually turn and get broken down into sugar, glucose, in your blood. So when you eat something, usually breakfast or lunch that has some sort of carbohydrates in it, vegetables, fruit, piece of toast, some rice, pasta, whatever it is, gets broken down. When you eat, your blood sugar goes up, and then the hormone insulin is what tells the sugar in the blood that it needs to go back down, and it tells the sugar that it needs to be used in other cells for energy and muscle repair and all these different things, basically for fuel. So when you're insulin resistant, basically your insulin doesn't work as effectively as it should at telling the glucose in the blood what to do, and the blood sugar doesn't go down when it's supposed to. There's a better chance that that sugar in the blood turns to fat, and it gets used for things like fat storage as opposed to energy use. So that whole connection there is kind of what's going on, and insulin levels stay too high, glucose levels stay too high, and then things drop when not supposed to. So basically, what you're trying to do is prevent those spikes and falls, and you kind of want more stability in your blood sugar when you're eating, when you're moving your body, and all these sorts of things. So one tool that you can use to measure this is a continuous glucose monitor, but blood work is the gold standard for measuring blood sugar regulation, which is often what we'd start with. but this is just an extra tool to kind of see on a continuous basis
And the effects of like
the effects.
of consumption.
Yeah, and you can track then too.
Yeah.
So you can say at 12 o'clock when you have lunch, you can say, you can make a note on the app that connects to your
Mhm.
continuous glucose monitor. Just had lunch, had chicken, potatoes, and some green peas. And then when you look at the data afterwards, you can see 12 o'clock, you ate, your blood sugar went up. It didn't go back down until maybe 3. And then you had a snack, you had some blueberries and a muffin. It didn't go back down until 3, but you also made it go up again at that
Mm.
time. So the timing of your eating, what you're eating, and all these different things affect your blood sugar and those spikes. So those are some kind of things we play with, basic changes you can make to control that.
Yeah. How long have you been wearing that?
It's good for about 2 weeks, so
Yeah.
I'm in about like a week so far.
Have you noticed anything that you wouldn't have guessed that had a spike to you, or is your diet already dialed in?
No, a couple things actually.
Yeah.
Yeah. So I had a soccer game on Sunday, and my blood sugar went up pretty high, and I was like, exercise usually brings down your blood sugar, but in this case it went up, and I realized that I was moving and I was working at such a high intensity that I needed to liberate some of my sugar storage. Glycogen is what it's called, and use extra sugar for fuel at that moment, which was interesting, which was a good thing. And I also noticed that certain times of the day when I'm feeling a bit tired, I'll get a notice on my app on my phone, and the sensor will tell me that my blood sugar is going a bit low. So maybe it's been too long since my last meal, um, and I need some extra fuel before. It's kind of happening like afternoon, late
Yeah.
afternoon before dinner. I'm waiting too long to eat, I guess. But yeah, my blood sugar is going too low, and that's why maybe I'm feeling a bit sleepy around 4 p.m. Um, so yeah, some things that I've noticed that um, I wasn't expecting, but are very insightful and things you can learn about your lifestyle.
Yeah, for sure. I look at it as all of this as like a big macro trends, right? Where it's like you have this bucket of like these different approaches, but like simple but effective, right?
Right.
Right. But then backed up by like the data that we have the ability to use, like one of those, right?
Yeah.
Like I've been wearing like a Whoop for over 2 years now.
Oh,
And my big learning is alcohol is poison. Don't drink it. That's my huge learning. Everything goes out the window.
Yeah.
If you drink too much, it's like your sleep is trash, your HRV is trash, your resting heart rate is trash. Like, that's a big learn. But like just learning about that and learning about like heart rates and all of this kind of all coming together, and then we're going to get this over the top, like the AI that's going to come into this and just be able to take a ton of big data and, come to these conclusions too, for us to make these decisions.
Yeah.
And it's like, they're all like common things, but we can personalize it because we're all made up like completely unique, right? Where it's just like, for some reason, when I eat, I don't know what it is, blueberries, it has this huge effect on my body where you'd be like, oh, blueberries are good for you.
Yeah.
It's like, oh, okay, blueberries are good for some people. Right. But, me specifically, it's, and just having it all put together. Right. So,
yeah, no, it's interesting. Another thing that a lot of patients will request upon appointment or initial appointment is getting further testing done and using those tools to see how we can tailor a plan for them, an individualized treatment. And so blood work is a big thing, but through blood work, you can also do, you mentioned like a reaction to blueberries, for example. Food sensitivity testing is huge, and using blood work and things like that can really individualize someone's experience and their treatment and give kind of a reason to maybe a feeling they've had before that couldn't be explained. Like, oh, I'm not lactose, but like I kind of feel funny. Like my stomach feels a bit funny when I eat this certain cheese, and it's just this one cheese, but it's not all cheeses. I'm fine with ice cream and milk, but like I don't know why. And then I get constipated or blah, blah, blah. This happens, that happens. So using those tools, you can really figure out what's going on with a person. And it's really interesting.
Yeah, like the food insensitivity one. Like I want to do that. A couple people in the office have done it.
Oh, yeah.
And it's just shocking too, because, a lot of the time I've seen a common, like they're like, they are consuming because they're like, this is what's healthy, right?
Mm,
They're like, whatever it is, avocados and chia seeds and this. So then it shows up on the test, like your body's super sensitive to that,
yeah.
right? Like, so you're like thinking that you're doing something beneficial, but really it's, those are the things that are kind of making you feel whatever way,
Yeah.
Yeah.
Yeah. You'll see like patients who say, I'm eating all the right things, but I still feel poorly. But I feel better if I eat garbage, if I eat fast food. Sometimes that's something to look into. If your food sensitivity test is coming up with all these healthy foods, it may not be the foods that you're reacting to. There's nothing inherently wrong with the foods. It's something going on in your digestive tract, your lining, your gut, that's making you more sensitive. So we have to work on that and maybe, chill out with the excess, whatever, the foods that you are reacting to for a little while, maybe a couple months or so, and then reintroduce them and see how you handle them better after working on your gut and things like that. So
Yeah, this is another thing that I've been hearing a lot. Like it all comes down to the gut. Are you a believer in that? Like,
I'm starting to learn more and more, but a lot of things are related. Yeah, it's crucial. There's so many things that go on in your digestive tract,
Yeah.
whether it's absorption of vitamins and minerals. You can be anemic if you're not absorbing the iron properly in your gut. And people just think, oh, I got to take iron, whatever. If you're taking the iron, not absorbing it, and it's not going to help, you're still going to feel bad. You're still going to be tired every day and weak and pale and this and that. So there's that. There's the gut microbiome, the bacteria, the good bacteria that live in your gut. They're responsible for so many things. There's the gut-brain connection. And for people that doubt that connection, just think about when you're about to give a speech or about to play a big game or go into a big meeting. Do you feel like your stomach's a bit funny? Do you have to go to the washroom? All of a sudden you have to go and have a bowel movement? Yeah, that's your brain telling you you're nervous. There's a connection between those two things. So your gut is responsible for so many things. So it's a big part of treatment.
Yeah. Okay, as we close up here, what's one habit that you wish more people paid attention to or implemented into their life?
I wish more people ate breakfast. I am not against the idea of intermittent fasting. I think for some people it works tremendously. But I think overall, if you're eating a good breakfast in the morning, you're going to set yourself up for success for that day. You're going to have more energy. You're going to be able to think more clearly. You're less likely to snack after dinner at like 9, 10, 11 p.m. because you're going to be more full. You're getting all those macronutrients in, so making sure you're getting protein and things like that in at your breakfast too is super huge. I've seen people's like anxiety throughout the day go down because they're eating a proper breakfast. Their energy levels go up. It's amazing what breakfast can do, but people skip it all the time. And sometimes the reasons for skipping it are they don't even know. They don't even know. It's just something they've been accustomed to. They just maybe 8 a.m. don't feel hungry, but it's okay. You can wait a little while. You can have your breakfast at 11 if that fits your schedule, but not eating until like 2 or 3, I think for most people is not the right choice.
Yeah, I love it. The return of breakfast is the most important meal of the day.
The return,
It's got that saying's gotten beaten up over the last couple of years. So I love to hear that.
Yeah.
Okay, for someone that's listening that's interested in working with you, what's the first step that they do? Like what should someone do if they want to come see you? And
the first thing is just having a conversation with either me or reception at Align Healthcare. You can book in an initial appointment. It's usually an hour, maybe longer if we take our time to really get to the bottom of the issues and the person's concerns, and we go through what they're eating, their sleep, their energy, their mood, all these different factors, and we kind of connect the dots. So just booking that initial appointment. You can call the clinic, email them. You can walk right in if you're in the East Gwillimbury area. But yeah.
Love it. Okay, we'll link it all up. check out Align Health Center. They got what you need. Okay. Thank you so much.
Thanks for having me.